returning patients from the 2010 trip when we did surgery on both of her feet, and at the time she was having difficulties getting her heels on the ground. Now she's able to walk steadily on her own. She walks to school 2 kilometers all by herself, which is absolutely fantastic. She doesn't have any pain, so I'd say that's a pretty good result.
There's so much action happening around. We have to set up a clinic. And then take all the people who have come for the first time and orient them to what needs to happen. All of the experienced people need to then mentor and explain and help set up the patients that need to be examined, re-examined, and set up for surgery. So it's quite complicated.
My dad's a doctor and he's a podiatrist and he helps people with their feet.
Thank you for coming. That really means a lot to me.
I completely enjoy seeing all the patients and screening them. To see them wait in line for such a long time just to see us, had to travel quite a ways to get here. It's a scary process for them, and you kind of see the fear in their eyes, and all you want to do is kind of help them and reassure them that we'll do the best we can and make them be more functional than before.
Thấp thoáng con xuồng bé nhỏ mong manh, non lá đồi nghiêng tóc dài con nước đổ. Hậu Giang ơi em vẫn đẹp ngang đời. Nhớ chiếc xuồng xưa năm nào.
The best thing to do is just be there, be reassuring. I pull my mask down a lot. Just even holding their hand, their blood pressure drops. They know that I'm there to reassure them. I tell them Ita, which means nurse. It makes me feel better to be there with them. It gives me a good feeling inside.
I've known some of our team members forever. Dr. Niska's I've been working with him since 1995, and Dr. Mullen since 2000 when he was a first-year student. It's really like these guys are family to me, and they give selflessly of themselves.
For us to really make a difference in these people's life, it takes a lot of administration, a lot of talking back and forth with the hospital, but most importantly, we need a lot of supplies because we're bringing absolutely everything that we would need to set up an operating room. So we bring sutures, we bring bone grafts, we bring screws and plates, along with all of our know-how. But without the funding and without all the equipment, we would just be tourists in the hospital. She was born with her foot like this, and now the side of her foot has become the bottom of her foot, so it's toughened up, just like the bottom of your heel would be. So we could correct it, so her foot could be flat on the ground. You have to lengthen the tendon back here, and take a big wedge of bone out of the back of her foot to bring her foot over and up. And then she could walk on her flat foot. This is my 5th trip, and every time that I've come, part of the money has been donated, but the majority of the money has been out of my pocket.
Every single member of our team has to do that, and that's why we've been so successful to get this done on a shoestring budget.
Em xin tươi trong